Myself, Staff Sergeant Blue, and my fellow classmates, Senior Airman Baruman and Senior Airman Banks, we will be discussing what has been affecting the health of people in the Phoenix area all year of 2020. Well, I'm sure most of you guys already know, but it is the worldwide pandemic known as coronavirus, or it can be shortened to COVID-19. COVID-19 is infecting every single individual in the United States and people in the world. It's one of the top leading diseases that the United States has ever had. COVID-19 has already infected 7.4 million people and ultimately cost the life of 210,000 people just in the United States. Now, Arizona contributes to that by having 220,000 cases with just a little over 5,700 deaths. And again, that's just in Arizona. That's a lot just for one state. So the real question is, what can we do to stop the spread of COVID-19? Well, no need to worry anymore, because with the killer bees method, we will not only decrease the COVID cases, we will ultimately get rid of COVID altogether. Now, Senior Airman Baruman will go over the 6-step process of the killer bees method. And following that, Senior Airman Banks will discuss in detail how we can do it and when we can do it. So to start, here is Senior Airman Baruman on the 6-step process of the killer bees method.
So, with coronavirus still on the rise, people are still falling victims to the pandemic. So we have forged a new and improved method to help mitigate this problem. We have named this method the killer bee method, paying homage to different models and processes such as the OODA loop, person's productive thinking model, and the 7-step problem process. Our method is a 6-step method composed of identifying the issue, observing, which is gathering an overall understanding of the internal and external complexity of the issue, orientation, which is reflecting on data received from observing, aligning our resources, which is to identify the people and other resources that we need to implement the solution, forging the solutions to help prevent the spread of coronavirus, and acting upon and executing said solutions. Now here is Senior Airman Banks, and he will tell you how these solutions will be implemented.
Thank you, Senior Airman Baruman. Good morning, my name is Senior Airman Shannon Banks, and as my fellow classmates already said earlier, I will be discussing our pandemic known as COVID-19, or the coronavirus, and how we can implement our 6-step method, also known as the killer bees method, to further prevent the spread of COVID-19 in our state of Arizona. So to begin our process, step 1 is to identify the issue, which we took away from the 7-step process of problem solving. As Staff Sergeant Blue already stated earlier, the state of Arizona alone has already had as many as 200,022 cases and over 5,700 deaths that have already been confirmed. And the virus shows no signs and symptoms, or no signs of slowing down. And many believe the virus will continue into the year 2022. Our second step is to observe, which we also took away from the OODA loop. We have to observe and identify the signs and symptoms of COVID early, which is a dry cough, fever, and shortness of breath. Many people have already shown these symptoms, or many people may be carrying the symptoms and don't realize they have it, and the mild symptoms may begin to turn more severe later if left untreated or if not caught early enough. So it's up to us to check ourselves out and to go get checked out and make sure that we don't have any of these symptoms. Step 3 is orient, which is also from the OODA loop, which is usually the focal point of the loop. People have to learn to adapt to these hard times, such as wearing a mask, carrying around some good hand sanitizer to keep your hands clean and disease free. Also, other cleaning products such as sanitary wipes, keeping those on hand, and to just wash your hands more frequently than you usually do. These steps alone can't 100% kill COVID, but it can delay or prevent the further spread to other people who you may come in contact with. Step 4 is to align our resources, which is from Herson's productive thinking model. As I stated before, having local stores and businesses provide masks, hand sanitizers, and other disinfecting products to the general public should alleviate the further spread of COVID. Also having a mandatory mask for going to like restaurants or any local stores or anything like that should be implemented to see a reduction of our cases. Step 5, forging the solution, which is also from Herson's productive thinking model. In this case, it would be for our governors and small businesses to implement a mandatory mask and have the signs on the door while we await our scientists to come up with a vaccine or some kind of medication that kills the virus or gets rid of it altogether. But in the meantime, we have to continue to police ourselves. If you know you're not feeling well, go get checked out. If you are coughing into your hand, make sure you wash it right away. Or just, quarantine yourself. Just basically police yourself, as I said, and take care of yourself, because the last thing you're gonna do is further the spread and go out in public knowing that you are not feeling well and you don't want to get anybody around you sick or your surroundings. Finally, step 6 is acting and executing, or just act, which is the final step in our solution and also the final step in the OODA loop. Having hospitals and other treatment facilities offering COVID-19 testing, free testing, should help us catch patients and more cases so we can treat them early and help those people get into quarantine, and also to police those who they may have come in contact with and contact them to also bring them into the hospital so they can be treated as well to further prevent the spread, and to pinpoint where the virus itself may be coming from, so that they can also be treated. After our actions have been implemented, we should also continue to observe the data we've collected and to see if our numbers have either declined, remained stagnant, or if they're increasing. If they're declining, then we have to continue this process. I hope it actually works out for everybody. If it's stagnant, then we have to double up on our policing each other. And if the numbers are increasing, then we're not doing something right. So hopefully our 6 methods, or the Killer Bees method, prevents the spread of this virus. One day, I hope we can all go back outside and enjoy our lives without wearing these masks. And thank you for listening to our methods.